For many individuals nearing retirement or already eligible for Medicare, deciding whether to stay on their employer-sponsored health plan or switch to Medicare with a private supplemental plan can be overwhelming. While employer plans might seem convenient, there are significant benefits to considering Medicare plus a supplemental plan, Medigap. You may find not only better coverage but also lower overall costs. Here's why this option is worth exploring. The benefits of Medicare Plus supplemental coverage: comprehensive care for gaps. Traditional Medicare, Parts A and B, covers most hospital and doctor expenses but leaves gaps such as deductibles, copayments, and coinsurance. Private Medigap plans are designed to fill these gaps, providing seamless coverage. Specific supplemental plans cover international healthcare costs, which employer-sponsored plans often lack. Lower out-of-pocket costs. Employer health plans, especially those with high deductibles or a percentage-based coinsurance setup, can lead to unexpected out-of-pocket expenses. In contrast, Medicare with a private Medigap plan offers financial security, reducing these financial surprises by clearly defining what is paid for by the plan under standardized rules. Freedom to choose doctors. Most employer plans offer limited provider networks, meaning you might need to stay in network with certain doctors and facilities. In contrast, Medicare with Medigap offers a liberating level of flexibility. Medicare is accepted by a vast majority of providers nationwide, and Medigap simplifies cost sharing with these providers. There's no need to worry about being out of network, giving you the power to choose the proper health care. Prescription drug coverage. Pairing Medicare with a prescription drug plan, Part D, allows retirees to customize their medication coverage. This often results in better cost control than employer plans, which may not be optimized for retirees' evolving drug needs. Flexibility with life changes. Employer-sponsored health plans generally lock you into the company pricing, while Medicare supplemental plans allow for more flexibility if and when health circumstances or income levels change. For instance, Medigap premiums are unaffected by your income, helping you budget more predictably. Potential cost savings. Employer plans often bundle the cost of dependents and retirees together, sometimes leading to inflated premiums for retirees. By transitioning to Medicare and adding private supplemental coverage, you could see a lower price tag and a brighter financial future. While Medigap plans have premiums, they may be competitive or cheaper than what you're paying now under an employer-sponsored plan, especially when you factor in reduced out-of-pocket expenses. Additionally, Medicare does not require employer-mandated contributions or fees for dependents, as opposed to employer plans that may charge for dependents even if they're no longer on your plan. Over time, these hidden charges can make sticking with an employer plan more expensive. Factors to consider. While Medicare and private supplemental plans work well for many, they're not a one-size-fits-all solution. Here are a few considerations before making the switch. Evaluate employer benefits. Check whether your employer plan offers robust retiree benefits or generous subsidies to offset costs. If it does, it may still be worth staying on the plan. Timing is key. Enroll during your Medicare Initial Enrollment Period, IEP, to avoid late penalties. If you're transitioning from an employer plan, coordinate the end dates to avoid gaps in coverage. Switching from an employer plan to Medicare involves notifying your employer, understanding your COBRA rights, and enrolling in Medicare. It's important to plan this transition carefully to ensure continuous coverage. Medigap plan options by state. Not all Medigap plans are available in every state, and some might offer additional benefits you find necessary. Spousal coverage. If your spouse is younger than 65 and relies on your employer-sponsored plan, switching to Medicare could leave them uninsured. Practical advice. Before making any health coverage changes, it's advisable to consult a licensed Medicare consultant. They can help you compare employer benefits versus Medicare plus Medigap, Review your expected healthcare needs and ensure you make the most informed and cost-effective decision. A Medicare consultant can provide personalized advice based on your health status, financial situation, and future healthcare needs, making the decision-making process easier and more reliable. If you're ready to explore Medicare and private supplemental options, start with estimating costs for Part B, Part D, and Medigap premiums. Also, Medicare Advantage is an alternative that combines Medicare and some supplemental features into one plan. The key is carefully assessing your financial and healthcare priorities to ensure your coverage fits your lifestyle. Have you considered how a supplemental plan could provide more freedom and fewer surprises than your employer's health plan? What steps will you take to explore Medicare options that fit your health needs and financial goals today?